This episode of the Burnout Recovery Podcast is brought to you by MEGA, your medical indemnity partner. Whether you're starting out in your career or have decades of experience, MEGA helps you thrive with support that goes beyond insurance. Enjoy travel benefits like complimentary travel insurance and Qantas points on your membership, plus education, medico-legal support, access to career coaching and wellbeing resources. Visit mega.com.au to learn more. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au. Busy day, quick question, no time to dig. Heidi Evidence brings the evidence to you. Clear answers with citations you can trust. Completely ad-free, unlimited and region-aligned. Find evidence in the chaos. Search HeidiHealth.com.
Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician.
Hello and welcome back to the Burnout Recovery Podcast. I'm Dr. Joe Braid, your host, medical doctor of over 20 years, and someone who's passionate about helping healthcare workers and helping professionals not just survive, but truly thrive in their careers. If this is your first time listening to the podcast, a very warm welcome to you. Today, we're diving into something that might feel a bit uncomfortable, but it's absolutely essential. We are talking about organizational burnout, and specifically what your workplace might be getting wrong. Because here's the thing, while we've been told to meditate more, practice self-care and build resilience, the real drivers of burnout often lie in the systems around us, not within us. So if you've been wondering why your individual efforts aren't quite cutting it, this episode is for you. Let me start with a story that might sound familiar. Recently, I was coaching Jenny, a senior nurse in a busy ED emergency department. She came to me exhausted, feeling like she was failing because despite doing everything right, she was exercising, eating well, even practicing mindfulness on a regular basis. She was still burning out. Joe, she said, I feel like I'm trying to fill a bucket with a massive hole in the bottom. No matter how much I pour in, it just keeps draining out. As we talked, the real picture emerged. Her department had cut staffing by 15% while patient loads increased, which is very much the case in many ED departments that I'm aware of. The electronic health record system was not without its problems, either going slow or crashing, and she was expected to mentor new graduates while carrying a full patient load. And when she raised concerns about patient safety, she was told to be more positive and focus on solutions. And Sarah wasn't failing. The system was failing her. I've had many conversations and done many coaching sessions with healthcare workers over the years. Another example is a physiotherapist who is seeing 20 patients a day with 15-minute slots. Barely enough time to do a proper assessment, let alone provide quality treatment. And then the physio started questioning her competence, wondering if she was just too slow or way too thorough. In every case, these dedicated professionals were blaming themselves for what were fundamentally system failures. They were trying to provide excellent care within structures that made excellent care nearly impossible. And what struck me most about these conversations was how often I heard the phrase, "I must not be cut out for this." But when these same professionals moved to better designed systems or when their organizations implemented meaningful changes, their burnout symptoms dramatically improved. So really, often it's not the individual, it's the system. I have a lot of research here to back this up powerfully. A landmark study by the Mayo Clinic analyzed over 2,500 physicians and found that organizational factors, these are things like workload, scheduling control, and organizational culture, accounted for significantly more variance in burnout than individual factors. Dr. Christina Maslach's research, she's the pioneer in burnout research, identified 6 key organizational risk factors. workload, control, reward, community, fairness, and values. And when these are misaligned, burnout becomes almost inevitable, regardless of individual resilience. A comprehensive meta-analysis published in the Journal of Occupational Health Psychology analyzed 182 studies involving over 109,000 workers. The results? Organizational factors are consistently more predictive of burnout than individual factors. We're talking about effect sizes that are considered large in research terms. In healthcare specifically, a study of over 6,000 nurses found that unit-level factors, these are staffing ratios, manager support, organizational policies, explained the majority of variance in burnout scores, with individual factors playing a smaller but still meaningful role. And the American Medical Association's Steps Forward program analyzed burnout interventions and found while individual-focused interventions around stress management and resilience training showed modest improvements of 10 to 15%, organizational interventions, this is changing workflows, improving scheduling, and addressing workload, showed improvements of 25 to 50%. The World Health Organization now recognizes burnout as an occupational phenomenon, not a personal failing. And this is huge because it shifts the conversation from what's wrong with you to what's wrong with your workplace. And their classification specifically notes that burnout results from chronic workplace stress that has not been successfully managed. And notice they say workplace stress, not personal stress. The research from the National Academy of Medicine shows that addressing organizational factors is significantly more effective at reducing burnout than individual interventions alone. But here's what is important. That doesn't mean that individual factors don't matter. They absolutely do. So here's the key insight. Most resilient individuals still struggled in toxic systems, while even those with fewer personal resources thrived in supportive environments. The system matters more, but your individual response and choices still have real power, especially when you understand what you're working with. So the research is clear. If you're burning out, it's probably not primarily because you're not resilient enough, not mindful enough, or not practicing enough self-care. The system around you likely needs attention. But that doesn't mean you're powerless. It means you need to be strategic about where you focus your energy. So here's 4 key areas you might want to evaluate within your own organization. First of all, look at your workload. Are the expectations realistic and achievable? And in healthcare, this means looking at patient ratios, documentation requirements, and time allocation. If you're always working through breaks or staying late to finish charting, that may well be a system problem, not a time management problem. Secondly, control and autonomy assessment. Do you have input into decisions that affect your work? Can you influence your schedule, patient assignments, care protocols, even when you go on leave? Who's going to be the person responsible or the person in charge of any communications so they don't go to you while you're on leave? What happens to your email when you're on leave? Research shows that even small amounts of control can significantly buffer burnout. Thirdly, recognition and fairness. Are contributions overtly acknowledged? Is workload distributed fairly? And are promotions and opportunities transparent? Because when high performers consistently get more work without more recognition, that can be a recipe for burnout. And finally, values alignment check. This is really big in healthcare. Are you able to provide the quality of care you believe in? Because when organizational pressures force you to compromise your professional values, moral injury follows closely behind. I've done podcast episodes not that long ago on moral injury and burnout, and you might want to listen to those to understand more around moral injury. So here's the empowering part. You don't have to accept a broken system. Start documenting patterns. When do you feel most frustrated? What specific policies or practices create stress? This is data collection. It's not the same as complaining. Consider joining or forming a workplace wellness committee. Many organizations are genuinely interested in reducing turnover and attrition and improving satisfaction. They just need the right information. And remember my framework: sleep, support, mindset, and movement. And while system change is crucial, these individual factors become your protective armor. They won't fix a broken system, but they'll help you navigate it more effectively while you work towards change. You do have agency here, and I invite you to use it strategically. So you might want to reflect on what I've gone through today. Over the next week, choose one of the 4 system check areas and really examine it at your workplace. Don't try to fix everything at once. Just start to observe and document. Think about this. If I was designing this system from scratch, what would I change? And sometimes the most obvious solutions are the ones we've stopped seeing. And here's a reflective question for you. What would it feel like to work in a system that truly supported your well-being and professional growth? And hold on to that vision. It's not naive, it's necessary. I invite you to share one observation about organizational burnout factors with a trusted colleague this week. Not to complain, but to start a conversation about what could be different. Change often starts with one person saying, "This doesn't have to be this way." And remember, you have more power than you think. While the system may be the bigger contributor to burnout, your individual choices about how you respond, what boundaries you set, and how you care for yourself still matter enormously. Focus your energy where you can make the biggest impact, and sometimes that's advocating for system change, sometimes it's strengthening your personal resilience, and often it's both. Advocating for better systems isn't just about you, it's about every colleague who comes after you, and ultimately about the patients we serve. They deserve caregivers who do feel supported, not depleted. You may recall I am one of the facilitators on the Schwartz rounds here at Bathurst Health Service, and that is a wellbeing wellness program designed in 1995 and continuing across the globe. And I'm so proud and grateful that we have this wellbeing initiative in Bathurst Health Service to help hospital-wide staff feel supported. If this podcast episode resonated with you, I'd love to hear about it. Connect with me on social media and join my newsletter where we dive deeper into these topics with practical strategies you can implement. Links are below in the show notes. Until next week, remember, you're not broken and you're not alone. The system may need the most fixing, but you still have the power to make meaningful change in your own experience. Thanks for listening. I'll be in your ears again next week. Cheers. Ready to take the next step in your burnout recovery journey? Visit drjoebraid.com for free resources, all 150 plus podcast episodes, and information about my keynote speaking. Links are in the show notes. Your well-being matters. Protect the asset that is you. You know those moments where you're between patients, everything's moving fast, and you just want to double check something without falling down a rabbit hole? Heidi Evidence helps you to get to a clear answer with citations you can see pulled from trusted guidelines, research, and even your own uploaded docs. It's completely ad-free, no sponsored results, no weird ranking, and it's unlimited, region-aware, and fits into the workflow you're already using. It supports your clinical judgment. You stay in control. Find evidence in the chaos. Search HeidiHealth.com. Be your best you. Rely on MEGA for your protection and support, serving doctors for over 125 years through insurance, education, medical legal advice, and member benefits designed to help you thrive and succeed. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au.